I'm Caloris. I'm your nurse. I need to do a head to toe assessment on you. Is that okay? Okay. Well, I would like to go ahead and get started with that. Um, we'll go ahead. I'm gonna perform hand sanitizer. Okay, so we got the hand hygiene. Could you give me your name and date of birth? Okay, thank you. I'm gonna go ahead and put my gloves on that it matches. I ask you to, if you don't mind, if you would set up for me. And what I'm gonna do, I'm inspecting down to eye level here. I wanna inspect your head. I'm gonna be doing every system of your body. I am going to start with your head and your face. I'm going to be asking you questions as I go. I will be having to touch you, but I will let you know. I also will need to be listening to your heart sounds and your breath sounds with my stethoscope and your bowel sounds. So first I'm inspecting. Okay. So now I'm going to be checking your hair, your scalp, feeling it down the center here for the shape of it. Okay, getting an overall look of your face. Okay, I'm looking at your eyes and how your eyebrows and all, how it all coordinates. Okay, your facial features. Alrighty. I thank you for that. So from here, I do want to assess your eyes. So we'll start with that. And what I would like for you to do, you can look right over my shoulder. I'm gonna come in. Okay. Okay, and then I want you to look at this as I get closer. All right, thank you. Now, what I want to do is I'm going to go ahead and I want you to follow this pin, okay, and keep your head still for me. So this would be my left. I want you to just yep, look. There you go, okay. Then can you look down? Okay, how about up and over? There you go. Okay, we're gonna do this with this eye. Over here, I'd like for you to okay. Then I want you to look down, and all right, as we go, all right. Now look up for me. Okay, very good, okay. And then as we're getting to it, I'm going to turn the light back on, okay? And I thank you for that. Okay, now I'm going to go on with, while we're doing that, I want to know if you can take your head and put it down to your chin. Okay, good job. Now, can you hold your head up as to look back at the ceiling? Okay. Are you having any pain anywhere? Okay, good. How about your ears? Have you had any drainage or, any problems with your hearing? Okay. I just want to get a good look at them. I want to check your ears for any drainage. We'll look in there, pap around on the outside of them. I'm going to do the same thing with this one here. Okay, good job. All right, now what I want you to do, I want you to bend your head as if you're gonna take your ear to your shoulder. All right, thank you. And can you do the opposite side? All righty. So now, if I was to get behind you, and I want you to cover up your ear, and I want you to repeat after me, 22. Okay, good job. Now can you do it with the other one? 15. Okay, well thank you. Alrighty. So then we're gonna move on down to your neck. And what I'm doing, I'm gonna go ahead and I'm gonna check your pulses here. Okay, and now I'm gonna check your pulse on the other side. Okay, I'm feeling your trach, the alignment. Okay, everything that's lined up good. Now, can you turn your head for me? I want to check just for any bulges. Okay, can you turn your head the opposite direction for me? Okay, and I thank you for that. All right, so now we're gonna move on with your shoulders. Are you able to shrug your shoulders and put a little pressure? Okay, good job. All righty, so then I'm checking here. Okay. I am gonna check your brachial pulse. Okay, then we'll check your radial pulse. Okay, then we'll do the same thing on the opposite side. I'm checking your your brachial pulse, and then I'm going to check your radial. Okay. All right. Now I'm wondering, are you able to, okay, now if you're sitting up, I want you to take your arms and can you hold them out to your side and back, okay? Then I want you to lift your arms up for me. Okay. And how about bringing them behind your back? Are you able to do that? Good job. Okay. All right. I want to check your fingers. Okay. Your joints. Okay. Cap refill. Very good. Are you able to put your fingers together? Okay, now separate them. Okay, good job. Can you touch your thumb to each finger? Okay, so we'll do the same thing over here. Did a cap refill. Okay, I want you to put your fingers together. Okay, then separate them. Okay, I'm inspecting them in your joints. Okay, so I'm gonna pull your covering down because we're gonna move right on to your chest. And what I'm gonna do, I'm just inspecting your chest. All right. Now I'm gonna go ahead, I've checked it, your skin is even toned, your respirations, okay, it's non-labored. Okay. Get my stethoscope and we're going to go ahead and roll this. Okay, I'm going to start over here with the aortic. Okay. Then we'll go to the pulmonary. Mitral. We'll go to the herbs point. Okay, so now that I get to the mitral, I'm gonna need to listen to this one for a full minute, okay? Okay, and I thank you for that. I am gonna go ahead and I'd like to check the posterior. And what I'm doing, while I'm doing that, I'm looking at your neck, making sure again that it is centered. Okay, I'm looking at your back, your overall, I'm inspecting it. Okay. Alrighty. And then I want to put my fingers here so that you can, I want to see the evenness as you breathe there. Okay. Thank you for that. All right. So now I want to go back, and then I am going to listen to your lung sounds. Okay, so we'll listen. Okay. We'll start up here. Okay, and then I'm gonna do the same with the back. I do need for you to go ahead and, when you feel me with this here, I want you to take a deep breath, okay? Okay. Breathe. Okay. 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 And I thank you for that. Now, what I do want to do, I want to go ahead and I want to assess your abdomen. Okay, so I'm inspecting your abdomen. Okay, I'm looking at the shape of it, I'm looking at the contour, I'm looking at the color of your skin. And now I'm going to go ahead and I'm going to check for vowel sounds. Okay, so we'll start in the right lower quad. Okay. Okay. All right, so that's good. Now I'm gonna percuss. I'm gonna take like a couple my fingers here, and then what I'm gonna do is I am gonna tap on my finger. Okay. So we're gonna. Okay. Now I'm going to go ahead and I'm going to palpate, and I want you to let me know, if you feel any pain. I'm going to do it lightly. Let's start out. Okay, now we're going to go down to deep, or let me know if you have any pain, okay? So is there any pain there? How about here? Okay, any pain here? Any pain there? Okay. All right, well, thank you. So now, I am gonna go ahead and I wanna check your pulse here. Your femoral pulse. Okay, we'll check the femoral pulse here. Alrighty, thank you for that. Right, while we're here, I want to just go ahead and check the strength of your hips. So are you able to, bend your leg for me? All right, and then against me. All right, can you cross it over? Okay, how about the same thing over here? Work it against me. Okay, bend your leg. Okay, can you cross it over to the other knee? Okay, good job. So now what I want to do is where we would go ahead and we would assess her genital system. some clean gloves. I would go ahead and, you know, get my chair. We want to only expose the area that we're going to be doing. It's got it well lit in here. She's got her legs bent into the little stirrups there, and we're going to check the symphysis pubis. I'm looking for, you know, her, looking at the hair distribution on here. I'm checking her skin. Okay, now is where I'm going to go on and check. And we're checking this, the color of the skin. We're looking for any lesions or any discharge. Okay, everything looks good. Okay. Now I would go ahead and I'm going to take my gloves off, dispose of my gloves. I would sanitize my hands again so that I can go ahead and continue to finish up what we're doing here. And I put on another set of gloves is what I'm gonna do. Okay. So do you have any problems with urinating or anything? Okay, well that was good. It looks good. So what I want you to do is with your feet, I want you to raise your feet up to the ceiling. How about like if you're gonna drive a car? There you go. Okay, I'm gonna check your capillary fills there, okay? And I'll check this one. Alrighty. I'm gonna check your dorsalis pubis, okay? I'll check this one here. Posterior. We'll check behind your knee. Pulse, poppets feel. Okay, and we'll do this one over here. We'll go in here and check it. All right, so we've checked in there. Okay, then now I'm gonna take your feet inward. And we'll go out with it. We'll go inward over here. We'll go out over there. Then I'd like it if you could stand for me. And then I would need for you to bend over to touch your toes. Okay, I am checking your spine. It's nice and straight. Okay. Okay, now stand up straight. You've already bent over. I need for you to bend back for me. That's good. Okay, can you twist your body? Okay, good job. And then can you walk away from me about 5 steps? Okay, and then can you come back about 5 steps? Okay, so the question, I want to let you know, we're pretty much finished with this. I do have a few things I'd like to do. I do want to test you. You sit back down from, okay. And I want you to tell me, what do you feel here? With your eyes closed, okay. And how about on your leg? How about this? Okay. And your toes. How about your arm? What do you, okay. Now, did they feel equal to you? Okay, and I just want to make sure, you know, that you need to have your vaccinations, keep them up to date. You're doing a good job with that. Your flu vaccinations, okay? Yes, and your colorectal cancer. You want to have your screenings for that, colonoscopy. And I'm going to, again, wash my hands, and this concludes my head to toe assessment. Thank you.